actually lied to you guys, and I'm sorry that I lied to you guys because I thought that I would get all that into number 5, but I was interrupted, and by that time I got frustrated and I decided to go ahead and complete the other one and start this one. So I apologize that you have so many little ones to do, but maybe that'll keep you from getting too bored. Okay, I really hurried through breastfeeding. I don't want you to think that I don't think that it's important, because I am very much a pro breastfeeder, and I expect you guys to be pro breastfeeders when you are in the clinical area with your OB patient. Those of you who feel comfortable enough to offer assistance, please do. If you don't feel comfortable enough, if I'm in the setting, come and get me. I'm a certified lactation counselor, and I can assist with breastfeeding. So I can help you out when we're down at Unity. Those of you who may go to OB, they should have at White River, there should be some actual lactation consultants there as well. So just grab one of those to help you out, or get your instructor. I know that Kendall has some experience, or Miss Barron has. So I feel very comfortable with her helping you out with helping others with breastfeeding, since she has worked in OB before. So something a lot of women ask about, especially postpartum, but even when women are breastfeeding, they are concerned whether exercise would affect their milk production. If they're going to be doing strenuous activities such as running, weightlifting, or anything like that, they need to nurse beforehand. For one thing, they need to get all the weight of the milk out of their breast, and be sure that their breasts are empty before they start doing strenuous exercise. They should always, if when they're not breastfeeding, unless they're at home and they need to air out their breasts to let their nipples dry, which is a really good thing, to go without a bra and let your nipples dry to room air, leave the breast milk on it, because breast milk is really in itself a good healing agent for sore nipples. So, if we're washing and scrubbing our nipples and we teach our patients to do that, we're not doing them a very good service. Be sure that they're wearing a good supportive bra. And when we're talking about a supportive bra, we're not talking about one that fits you really tight and has digs into your skin. If you've got a really tight bra, and especially those underwire bras, you need to teach the patients that they need to not wear those, because they can actually cause clogged milk ducts, and then you will invariably see mastitis beginning. It can also decrease the amount of milk that your breast will produce. So you want to teach them, wear a good supportive bra, but don't wear a tight bra. The only people we want wearing tight bras are those that we want them to stop lactating. Don't use soap. Soap on the nipples are going to cause them to crack and dry. They get enough wear and tear as it is. So don't be soaping your breasts and scrubbing them every time, especially in between breastfeeding. We don't really promote lactation consultants, and IBLCs don't advocate the use of breast cream, although at your facilities that you go to, they do actually advocate using lanolin. They need to be really careful with using lanolin with breast cream, because it can promote growth of yeast. Once you get yeast on your nipple, the baby's going to get yeast in his mouth, and it's going to be, baby's not going to be able to nurse, and your nipples are going to hurt. You're going to have to not only treat the nipple, but you're going to have to treat the baby, and they'll have to make sure that the yeast has totally been eradicated before they can actually breastfeed without transferring it back and forth. So, it's very important that they don't develop yeast on their nipples. Um, Breastfeeding without your bra on at least once a day is going to help to ensure emptying. If you've got a good support bra on and you're wearing it, it can actually, where it supports, cause you not to empty in those areas where it's supporting. So you should um, encourage breastfeeding mothers to at least once a day sit down without their bra on and nurse. That's really a good thing. They do skin to skin, take the bra off, but get comfortable with the baby. They relax, baby relaxes. It's usually a wonderful breastfeeding experience during that particular period of time. Don't use plastic lined pads in your bra. This is going to trap moisture, and this again will help yeast start to grow, nipples to crack. It's really hard not to wear a pad in your bra when you're breastfeeding because, you know, you go to Walmart and somebody else's baby cries, you're going to leak milk. So you don't really want to be embarrassed by being at the checkout counter and those photo bomb people are over there taking pictures of your wet t-shirt and pasting it on Facebook. Uh, that's really a terrible thing. So they can use pads in their bra, just not the plastic lined pads. They just need to change their pads when they get wet. So they should carry a couple extra that do not have plastic linings in them. Um, if your patient or is in Walmart and she does have that letdown effect, if she will just take her hands and press straight back on her nipples and apply pressure, that will usually stop the letdown occurrence and it'll stop leaking. Or you can actually fold your arms across your chest, and that will help prevent some embarrassment of leakage of milk. Of course, if your letdown occurs and your baby's there, just put that baby down there and feed him. So I don't think there should be any reason why moms can't breastfeed wherever they need to breastfeed. We have wonderful blankets, cover-ups, shirts that you do not see anything except that you've got something under your shirt that's nursing. You do not see the breast. So it's no way could it be offensive to anyone, and it shouldn't be. We as Americans are very censorious when it comes to things like that, which um, I don't understand. It's just a natural process. Um, we want to also, even though they're breastfeeding, to encourage breast self-exams. Um, they need to know, of course, that lumps that they find that are, you know, maybe big one day and small the next are actually just milk ducts, but they could actually develop breast cancer during when they're breastfeeding. I mean, there's no rhyme or reason to breast cancer and when it develops and when it's going to show. And so they still need to continue doing breast self-exams just to be sure that they are taught the difference between a milk gland that's full of milk and ducts that are full of milk versus a permanent lump that could possibly be cancerous. If they do begin menstruation while they are breastfeeding, that's okay. Doesn't have any effect whatsoever on breastfeeding. And as we said before, you know, if you are strictly breastfeeding, if exclusively breastfeeding, and that means you breastfeed during the day, you breastfeed during the night, and you don't offer the baby any kind of supplement whatsoever. It's just strictly breast milk from you, from the breast, the baby to the breast. It can actually act as a birth control method, but we don't recommend it as a birth control method because it is not 99% effective. Although that is what was used years ago before we had the advent of birth control. So menstruation, if they start their menstruation during breastfeeding, it's not going to take away from their milk production or how their milk comes in anything at all dealing with their breast milk. Um, when you do that exclusive breastfeeding, it's going to delay ovulation. That's why sometimes people have said, oh, it's a good birth control method if you exclusively breastfeed. Well, most women who think they are exclusively breastfeeding are not exclusively breastfeeding. A lot of women don't get up during the night to feed their baby breast milk. If the baby sleeps through the night, they'll sleep through the night. They don't get up to offer the baby milk halfway through the night. Most people don't. So that's not exclusive breastfeeding if you're not breastfeeding through the night. We really not had any contraceptives that's been approved before 6 weeks postpartum for women who breastfeed. Those contraceptives usually interfere with getting the milk supply established because it messes with the estrogen, messes with the prolactin and the oxytocin. So it's the different types of hormones just are not compatible with milk production. So why do I keep forgetting to park the phone? Anyway, um, just wait till it quits ringing. Most women will use the barrier method for contraception because breastfeeding alone is not a 99% sure method. It's more like a 50 to 70% ensurety you won't get pregnant. And, most people don't want those kind of odds. They want the odds where they could use the barrier method for contraception where they know that that's going to be more successful. Now, the barrier method for contraceptive are, like condoms, the sponge, things like that. Now, in the recent, I guess the recent year or so, they have begun to put IUDs in at delivery. So if a woman wants an IUD put in, they will actually put the IUD in at delivery. But I'm not a big fan of that. For one thing, IUDs depend on where they're at in the uterus, and the uterus is at this time not a stable organ. It is going to be large, it's going to be small, it's going to go back and forth a little bit. Remember, it starts out below the umbilicus, and then it goes up above the umbilicus, and then gradually comes back down to the umbilicus. And if you've got an IUD in there, that IUD is moving around as the uterus changes. So to me, it seems like that would not be the greatest method, but it has been recommended to do that. And so there are actually some practitioners that will place an IUD before you go home, which once an IUD is placed, you've got a really good birth control. As long as it's placed correctly, you've got a really good birth control for however long you keep it in there. There have been incidents where women get pregnant with IUDs placed, and my sister-in-law is one of them. They recommend removing the IUD if they get pregnant, but that will sometimes cause miscarriage. If it's left in, it can actually grow into the fetus. So it's not a good thing that if pregnancy does occur, and if it does occur with an IUD, it's usually got something to do with the placement of the IUD. So what do we do when we need milk? For if we go out on a date with our husband, wouldn't that be wonderful? Or if we have to go to a meeting out of town and we have to leave our baby who needs milk. Well, we have to learn how to pump. And a pumping is not as easy as it sounds. It's not just putting the pump up to the breast and let the pump do the work. Especially if you've got, when you have moms that have babies in the nursery and you tell them that you want them to pump so that they can start stimulating the milk letdown. Well, they can put those electric pumps on their breast, and it can sit there for 5 to 10 minutes and they won't get a single drop. So sometimes they have to pump for about 20 minutes on each breast before you will actually see any milk supply come. And usually it's very small amounts. You might just get a teaspoon. But you have to really encourage these moms that, that teaspoon is 5 milliliters. 5 milliliters is pretty golden to us, and the baby is going to definitely need the nutrition that's in the breast milk. So we have to teach them how to get the most out of their pumping. They have developed pumps that can actually do that chomp, and the chomp is what triggers that letdown. So if you can get the pump, and they're very expensive to get the pumps, the ones that are supplied at the health department are just straight electrical pumps. They go directly onto the breast, and then there's a sucking action, and that's it sucks. Sucks, let go, sucks, let go, just like a suck, swallow. Instead of the chomp, suck, swallow that usually is occurring with breastfeeding babies. But there are pumps now that you can buy, I think they're around $500, that actually will mimic the chomp, and they are actually the better pumps if you can afford one of those, to be able to increase your milk supply. Using a pump exclusively, you usually cannot keep a very good milk supply. Um, if you're pumping and breastfeeding, you usually can keep a good supply. And a lot of times after women go to work or go back to work and they are pumping, they'll notice a decrease in their milk supply. And it's simply because the baby's not doing the chomp suck thing, and so the breasts are reading that as the mom, and the baby's not nursing, and you're just pumping most of the time. The breasts are reading that as the baby's trying to wean himself off, so they stop producing as much milk. So you really, really want to encourage them to do breastfeeding when they're at home, and any possibly other time that they can. They can actually um, Reglan has been known to help increase milk production. So uh, there are several things that moms can do to help increase their milk supply. There's several herbs on the market that are supposedly well known to help increase your milk supply. So to help them get the most out of that pumping, massaging the breast before pumping helps trigger that letdown reflex, because they get the massage action that the little chomp would have given him. So tell the moms that before they start to pump, they need to massage their breast for several minutes beforehand. You want to tell them to actually start at the chest wall, right back close to the ribs where those lip glands are that y'all are supposed to know about. Those way back into the back, almost under the axillary, where the axillary lymph nodes are going to be, way back there, and work their way toward the nipple. And be sure they, are massaging, not just squishing it and pushing all the way to the front, but massaging the breast itself. Um, so this will help to get the milk all ready and primed to let down. And of course, if we don't, if they're at work and they can't go pump, and I know nurses have a lot of problem with this, in that when you're a nurse and working, you can barely empty your bladder once a day. So it's really hard to get those breasts, go take 20 minutes out to pump your breast when you need to go pump them. You can't just leave someone in a dire straits to go pump your breast. So sometimes your milk production will decrease because you're not able to empty your breast out in a timely manner. If you put warm compresses on your breast before you massage and then massage, that will help with the letdown reflex and help you be able to get more pumping, get more milk out with pumping. Another thing about pumping is that actually, if women would actually milk themselves, so to speak, instead of using a pump, but massage and actually hand express the milk from their breast, they can actually get more milk and will make more milk by doing that. And they will empty their breast better because they can get back here to the back side of the breast whereas the pump is only working in the front part of the breast. So if you can teach them how to self-express with their hands, yeah, it takes a little bit longer, but you have a lot better results with that. Especially if you've got someone who's complaining they're not making enough milk, they're losing their milk supply, and they want to continue to offer breast milk to their babies. As you're storing your milk, sometimes when you're pumping, like I said, especially if you've got somebody, baby sick in the nursery, you can actually pour several of those pumpings together. So, say you pumped 5 cc's and we refrigerated it, and then you pumped 5 more cc's, we're going to refrigerate that. And then after they're both cool, we can put them together. You don't want to put warm milk on top of cold milk. You can pump a breast at the same time the baby's feeding on the other breast to get more milk out. Sometimes babies will eat at one breast and then they're too tired to eat at the other breast. So you can go ahead and pump your breast and then feed what you get pumped out of the other breast to the baby. And actually, by stimulating both breasts at once, because the baby's chomping on the other breast, that triggers the pituitary gland to release more of the prolactin to be able to produce more milk. So it works really wonderful. So remember, oxytocin does our letdown, and prolactin does the production. So how are we going to store the milk? Women need to know how to store their breast milk. Those little disposable bottle liners are actually your best buds, because you can stack them on top of each other. You can put them in more of them will fit into the freezer or refrigerator, and they're also easy to set out in a bowl of warm water to get the breast milk warmed back up to at least room temperature, a little more. If you double bag the milk, of course, that's just like double bagging your frozen products that you want to freeze at home. It keeps your milk still protected just in case the outer bag does get punctured, keeps it from getting frostbite. So where do we store milk? Well, if you are pumping your milk and you're not getting very much out, and we're using it to feed your baby in the nursery, we're going to put it in the refrigerator. It can be stored in the refrigerator for up to a week. We usually say 48 hours, but the new guidelines is that it can be stored up to a week in the refrigerator. Like anything else, it's kind of like, how do you feel comfortable with that? So usually we tell them if they're going to use it within 48 hours, let's stick it in the refrigerator. If we're not going to be using it in that 48 to 72 hours, I like to tell them to go ahead and put it in the freezer. You can put it in the freezer for up to 6 months. It still maintains its consistency and its protective components. Be sure we're dating the bags. Be sure you tell them use the first one, put them in chronological order, and use the last pumped first. Don't ever refreeze breast milk if you thawed out too much. So another thing you should be teaching them is, store it in smaller amounts. Don't ever, if the baby's first is just starting to eat, never store more than 2 to 3 ounces in one bag at a time until that baby's getting up to where he's eating a lot, until you're using 2 bags every time, maybe 3. Then start putting more in a bag. Put 6 to 8 ounces in a bag. But try to make your bags do the what the baby needs, so that you're not pouring that precious breast milk down the drain because the baby didn't drink it. Say baby's only been taking 1 ounce. You've been working really hard to get him to take that 1 ounce, and you had to thaw out 3 ounces. We can't refreeze that, and you can't use it after the baby's nursed out of it. So you'd probably want to pour that in 2 separate containers and then use the thawed milk out within that 48 hours, but you cannot refreeze it. Teach them never to thaw or heat their breast milk in the microwave. For one thing, heating even formula or breast milk, either one, can have hot spots in it, just like anything else. As microwaves go through the cellular level, I guess, what you would call it, through the components of whatever the food is. In some areas are denser than others, so the microwave is more maybe hotter than in other areas. So you don't want to take the chance that you may scald your baby because you had a hot spot in that milk. Another thing is that if you heat it in the microwave, it's also going to take away some of those components of protectiveness that the breast milk has and kill off some of the protein. So it really changes the consistency of your breast milk or your formula. So you really never want to heat that in the microwave. You should, if you know your baby's going to just gets through eating, he's going to eat in another 3 hours, lay out a bag, let it be getting thawed out. And then when it's close to time to feed the baby, get you a cup of hot water and place the bag or bottle in that hot water and let the hot water warm it up. And of course, I always check to make sure it's not too hot. But if you're not doing, used to people would boil a pan of water and set the bottle in it till it got warm. And then you were finding that people were scalding their babies because they were letting it get too hot. But we're not doing that anymore. We put it in a bowl of hot water from the tap, and it usually will not get too hot. But you always want to check it anyway. Okay. You can actually induce lactation for people who have adopted babies. If they've never had a baby before, lactation is a little bit hard to get induced. But by giving them the hormones that they need, the prolactin, the oxytocin, and then letting them suck. And to get a baby to suck when there's not any milk there, we have this elaborate feeding tube attached to the breast, to the nipple, and then the other end is attached to the model of formula or breast milk that they are going to be nursing, and then they can actually nurse, and that can help cause the lactation to start. If a woman has lactated before and she chooses to breastfeed, I know there's been women who their mothers have breastfed their babies because they couldn't produce milk. Maybe they had breast cancer or something, and they actually can start. It takes a little bit longer, but lactation can be started. Remember when you're teaching moms about what to eat and what to drink, that caffeine, alcohol, nicotine, a lot of things can actually enter the breast milk. So you want to be sure that you are teaching them that, if they don't want a baby that's wide awake and jittery, you might not want to drink a whole bunch of caffeine before you breastfeed. Nicotine, smoking. Should you smoke and breastfeed? Well, a lot of people want to say no, but I still say yes because the nicotine enters the breast milk in small amounts. They should smoke after they breastfeed, and they should smoke at least an hour before they breastfeed, and they should never smoke during the time that they're breastfeeding. But breast milk has so much good properties to it that it outweighs the little bit of nicotine that will come through. And chances are, if mom's been smoking all this time and she's been smoking during the time she's pregnant, baby's going to have a little bit of nicotine withdrawal anyway. This might help you out with some of that withdrawal stuff. So, engorgement can occur, especially with our breast feeding babies when they're not emptying out the breast completely. Usually happens on that 3rd to 5th day postpartum. Mom knows pretty well that her breasts are getting extremely full. They get tender, they get hard, they get very, the nipples are extended way out. So when the baby tries to nurse, they can't get more than just the nipple in, and they can't get that areola in that I told you about. And if they can't do that, then they don't latch on well. And then you have a problem with the baby latching on. Usually engorgement is caused by not feeding your baby enough, or they're not latched on correctly. Or you're not, so you're not feeding them long enough. They're not actually being offered the breast long enough. So in order to get the baby on an engorged breast, you need to hand express the milk out until the breast becomes tender. A lot of times they'll wait till it gets so engorged that they can't get any of the milk out, and it's very difficult to actually get the engorgement to go away. When you allow engorgement to happen, you decrease your milk supply. So you really want to teach moms what to look for and how to avoid engorgement. It can even swell all the way up into under the arms and be very, very uncomfortable. So you really want to teach them how to prevent that. And so feed that baby at least every 2 hours. A lot of babies when they're first born want to eat every 30 minutes to an hour. And mom thinks that's abnormal. Well, it's not abnormal. They're not getting very much when they breastfeed, and every time they latch on, they produce more milk. So if they breastfed 3 times in 2 hours and then don't breastfeed for about 2 to 3 hours, then they still at least eaten, they've breastfed 3 times. So you kind of want to see what the pattern is that the baby wants to eat. Engorgement will usually last about 12 to 24 hours if you actually allow it to occur and you're not feeding your baby every 2 hours, making sure that they're emptying out the breast, changing the go from one breast to the other breast. If you started with the left breast, be sure that you start back with the one that you left off on to empty it out and go back to the other one. Engorgement, we can apply ice for pain. 15 minutes on, 45 minutes off. We don't want to kill the tissue there, so we don't leave the ice on for more than 15 minutes. Engorgement again can be treated with those fresh cabbage leaves. They feel really good on your poor, hot, suffering breast to nestle them into a cabbage leaf. And you can leave those on for up to 2 hours. You just change them when they start getting wilted or when you start to feed. They do have some medicinal components inside the leaves that help. Tea bags doesn't do any good for an engorged breast. They're only good for those cracked nipples. Usually, if you try to put heat on them, that's just going to increase the blood flow, going to make them a little bit more engorged instead of helping with it. But sometimes it will start the milk leakage. So sometimes you can actually tell them to take a bowl of water or take a warm shower, and it might actually start the milk to leak out. But a lot of times, if you try to put heat on it, it would be counterproductive. So be sure that we don't, that we're very careful in how we are treating engorgement there. Of course, your malarial infections, that's your yeast that you're looking at. So be sure that you are inspecting the mother's nipple. Usually in the 24-hour time frame you have them in the hospital, you're not going to see this happen. Babies don't usually develop yeast diaper rashes or things like that before they've gone home, and they've been home for sometimes. So usually you would see this if you were in a home health setting, or if you are part of the nurse that they're coming back to see after they've delivered their baby. So you want to be sure that mom's complaining about how painful it is that on her nipple, be sure and inspect for that. And like I said before, you have to treat both the nipple and the baby's mouth at the same time. And be sure you're teaching them good hand washing. Sometimes thrush can develop from sticking dirty. People like to stick their fingers in baby's mouth to see how well they suck. So some people will stick their fingers in your baby's mouth without washing their hands. So, and you need to teach, and some moms will do that. So you want to teach them, be careful. Wash your hands. You don't want this to happen to you or your baby. If we have a diabetic mother that's feeding, and we do have diabetic mothers that feed, and this is true with even with a postpartum that's not breastfeeding, but breastfeeding itself will decrease the insulin requirements because we're using up more of the glucose that we're eating during lactation and production of milk. So she can actually eat more food and take less insulin during the time that she's breastfeeding. So she really needs to make sure she's on more or less a sliding scale, making sure that she's checking her insulin, checking her blood sugars daily, to make sure that she doesn't have hypoglycemia, and lower her insulin dosages as she needs it lowered. Of course, once they wean, she's going to go back to her needing more insulin. So she really needs to be followed closely, to make sure that her insulin needs are meeting her glucose in her bloodstream. So also with diabetic mothers, because you have this increased glucose, you will see that sore nipples, um, because of yeast infections, is fairly common. It's like most diabetics will develop yeast infections genitally, so they can also develop it in their nipples as well because of their diabetes. So this is another thing that you have to make sure that they're monitoring for very carefully. Okay, now we all know that not everybody breastfeeds. Not everybody wants to breastfeed. Not everybody can breastfeed. Although I like to think everybody can breastfeed. They just may have to work a little harder at it than others. Some babies will hop right on there and make mamas happy and stay that way, and you have really good breastfeeding retention rates. Um, when you've got these babies that are really hard to get them to latch on, they may have some difficulty with their oral fixation. Maybe somebody suctioned them too hard at delivery and they just don't want to breastfeed, don't want to stick that nipple in their mouth. Those are the ones that make it hard. So we still have moms that prefer to use formula, whatever reasons they choose. Now, when we get down to this point where mom decides between breastfeeding and formula feeding, we must support whatever decision mom makes. If mom decides to formula feed, even though I'm very pro breast, I will not make her feel any less of a person because she formula fed. This is a personal choice, and it's her body, and she should be able to decide if she wants to have a baby at her breast or not. Some people are just too anxious, they are too embarrassed, modest, whatever you want to say, to breastfeed, and just the thought of it makes them cringe. So, that's okay. We've got formula, and formula works. There's 3 different forms that we get our formula in: powder, concentrate, and ready to feed. So those of you who have ever used formula or have worked in the nursery, the formula in the nurseries come ready to feed. Comes in small bottles, ready to feed, doesn't have to be mixed, and it's fed at room temperature. When I was having babies, you always warmed up the formula. You did not. In fact, when I went to work at White River in their OB department, they actually had a stovetop, electrical stovetop that they used to heat formula with so that they could boil the water. They didn't have microwaves then. So they actually had that still going. I mean, they had a microwave then, but they didn't have them readily. So they were very expensive. Um, the powder is the least expensive and it's really the most convenient. But you have to teach the parents how to mix the concentrate and the powder. If they put too much in, they'll give their babies diarrhea and cause electrolyte imbalances. If they put too little in, then they get water toxic and they don't get enough formula and they get nutrition deficits. So you want to be sure that you are teaching them to follow the instructions to the letter and not to put more water in it or put more formula in it. It needs to be exactly the way that it is. The reason the powder is more convenient is you can take several bottles and you can just put however much powdered formula you want to reconstitute in each one of those bottles, throw them in your diaper bag, and all you have to do is add water. If you have concentrate that you have to put in the bottles, even if you added water later or added water at the time, you still have to refrigerate that. So that milk has to be kept refrigerated. Whereas the powder, doesn't have to be refrigerated, and it can be reconstituted on the spot and be used that way. We don't sterilize formula anymore, and of course, we certainly, you have babies that have trouble drinking the formula. Some of them go from the milk-based formula to soy-based formula to a formula that I'm not sure what's in it, but it smells so bad that nobody wants to smell it. I don't know how babies stand to drink it, especially since they have such a heightened sense of smell. But there's just sometimes that parents will say, oh, it's a lot cheaper to do this. Now, I know that when my mother was growing up and actually raising children, evaporated milk was used a lot, and reconstituted and fed to babies in place of commercial milk and breast milk, because it was cheaper and it was available. So it's really not got adequate nutrition in it. It doesn't have the added iron that all the formulas have in them now. And it's not, most formulas have gone through testing after testing after testing, and they've gotten them as close as they can possibly get them to breast milk, although it's still not the same, but they have gotten them as close as they can get them with the addition of iron. And that addition of iron is what causes most babies to have a lot of tummy problems and colic, because iron is hard on your tummy. We have to address neonatal pain, because babies do feel pain. And a lot of your, I know when I first started to work and we were doing circumcisions, most of the physicians that did the circumcisions didn't believe babies felt pain. Research, of course, has proven that yes, babies feel pain. I mean, if you do an AccuCheck on a baby's heel once, they'll cry. When you go to do the second one, they'll pull away. When you go to do the third one, they'll pull away and start crying. So they know what pain is, and they know what's associated with pain. So we're finding out more and more that neonates can actually, you can imprint a lot more things on their little brain than you think you can. Usually, crying that's associated with pain is real intense. They'll cry sometimes if they're laying in their crib, just cry, kind of just a fussy cry. But when they get ready to cry because you hurt them, it is a scream. Sometimes they hold their breath a little bit and then they scream. Usually, we go by their facial expressions and their specific characteristics. You actually have a pain scale, pain scale that is, Unity has it specific to their nursery that they run on all their babies, and you'll be acquainted with that. They'll squeeze their eyes together, their little brows bulge, they'll open their mouth, their tongue will stick out and be really taut. So you really have to make sure that we're addressing this. We actually had finally got a policy, our standing orders for, with our circumcision, that we could actually give Tylenol before the circumcision was done and after, for any perceived pain, that we perceived that the baby was in pain. You can imagine, after having a circumcision and peeing for the first time, can you imagine how much that must sting and burn? I mean, it's got to be painful. So, we should not discount that our babies, just because they're little, can just deal with the pain. Babies also have to have a Guthrie test done. The Guthrie test is the actual test, and phenylketonuria is what we have associated with the Guthrie test. This is a test that affects mostly white children, especially in the U.S. and Northern Europe. So we have been testing for this for decades. We used to, each state has its own specific genetic disorders they test for on this Guthrie test. And the one that we are going to talk about right now is the phenylketonuria, PKU. Um, Once you get the, you're born with it, you live with it. If you have children, it's going to affect you and your child. So this is something we really need to test for, because we can actually prevent mental retardation if we make sure that they are on specific diets. So it is a genetic disorder. If I have it, my child is most likely going to have it. If I have it and I don't keep my phenylalanine intake down, then my fetus is going to be retarded. My fetus may have genetic disorders. It may be genetic anomalies. So this is very important that we know if our kids actually have this. They need to ingest formula or breast milk before we do the test, or we don't know if this amino acid is absent or not. Because if we don't need it, it's not produced. So they've got to take in the milk. So we usually don't do this test until 24 hours of age. And if we have a baby that goes home early, say went home in 12 hours, we have to do the PKU in 12 hours. But they prefer that you do it do it at 24 hours of age, or between 24 hours and 72 hours of age. The more milk they ingest, the more we'll be able to see if this amino acid is missing. The bad thing about this test is it really takes a long time for it to turn around. You do the PKU at the hospital before the baby goes home. And then this particular Guthrie slip is sent down to, in our case, it's sent down to the Little Rock State Department labs. And it'll take 6 weeks to get results back. Well, they've actually have had some actual bad outcomes because of this lag in return, and they're working on that. The hospitals have to get them down there within so many hours of them being drawn, and then they have to have them done within so many days of them receiving it, so that we can start treatment for these disease processes. We have to withhold phenylalanine from our babies in order to prevent them from getting developing mental retardation. So again, it's diagnosed with that Guthrie blood test. Tests should be done on all newborns before they leave the nursery. If they've left the nursery early, say they left at 12 hours of age and we did their Guthrie test, we really should repeat the test by the 3rd week of life if it's been taken within that first 24 hours. That way, if they didn't have enough protein ingested, then we would be able to do the test after they've had enough protein ingested that we can tell whether or not they have developed PKU. And the reason we do that is because there is a very large number of infants that aren't rescreened for PKU. You've got those that do home delivery. You've got those that deliver in the birth centers. In Arkansas, it's not a big issue because we don't have I don't even know of a birth center in Arkansas. But if you, when you have them going home early, then there's not very many doctors that want to take on the legal responsibility of sending babies home before 24 hours. So we don't see a lot of this done, but in other states, they see a lot of infants that get sent home or that are home birthed that aren't getting their PKUs screened appropriately. And we're really missing out on diagnosing, especially the PKU. Arkansas started out with the testing for phenylketonuria, galactosemia, thyroidism, hypothyroidism, and galactosemia. Now there are 26 or 32 genetic disorders that we are testing for with that Guthrie slip. It used to have 4 circles for blood. Now it has 5, and we added 20 some odd more tests to that. So it's really come a long ways. March of Dimes was very instrumental in getting this done. So, and I think it's a good thing, because even if it's one baby out of 10,000 develops that genetic disorder, it's worth that one extra drop of blood that you get from all the babies. You've got the blood coming out anyway. It's worth it to keep that baby from developing mental retardation. So it's just really a good thing to have the Guthrie test that we're doing. And that really is the end of this lecture.